Now, as you can see by the photograph on the right of this Capuchin monk who is assisting these two people in an apothecary, you can see that in time, monasteries will produce medical experts who will assist people who are outside of the monastic community. But initially, that's not where monastic healthcare, a form of healthcare that will emerge in the hospital proper, that's not really where it first starts. It starts from within. It starts from the fact that you have a large, sometimes small group of people living together, and they are going to get ill, people are going to be injured, and people are going to age, and they're going to need medical care. And so as you can see by the fact that I love this image from a manuscript of this monk sitting at the bedside of his companion with his hand tenderly resting on the bed and on the foot of his fellow monastic figure. You can see the care that has to be there. So there are a few ways in which monastic healthcare as a medical network is going to influence the history of medicine. First is that monastic care is going to be local. And by local, I mean that within monastic communities, you're going to have a place that is set apart for those who are ill, known as the infirmarium. And from that, we get infirmary. The infirmarium is an inpatient supervised space for medical care. And we can see from the blueprint of a 5th century monastery of Abba Jeremiah, we can see that the monastery has at the center the hospital. So here we have a court, here we have various outbuildings, here we have the refectory where they get together for meals, and the church is located down in this direction, and here we have monastic cells. And right in the center of all of this, you have a hospital and rooms for those who care for those in the hospital. In fact, this is going to be written into some of the earliest monastic texts. For example, in the life of Pachomius, it is written about Pachomius, this monastic founder, that Pachomius appointed another Pachomius appointed another house of stewards to give comfort to all the sick brothers with attentive care according to their rules, and over them a housemaster and a second in the same way. Sorry about that error there. I could take it out, I could edit this, but it's kind of nice for you to see that I make mistakes too. So, in addition to monastic healthcare being local, being centered there in the monastery, there was also a type of ambulatory care that needed to take place. So in other words, medical care wouldn't just happen in the monastery, but it would happen outside of the monastery. Healthcare was taken to members of the community who were outside of the community. And of course, from this word, you can see ambulance, a traveling medical facility that goes to those who are not on the inside. So ambulatory medical care was concerned a lot of the time with hygiene, with making sure that people were clean, that they had clean water, and that their living conditions were not antiseptic or sterile, but were certainly conducive to good health. And guess what? Hygienic. I'm sure we can recall that the daughter of Asclepius was Hygeia. Okay, so we're reminded of the roots of these medical terms as we go through. Another task of ambulatory healthcare was to provide palliative care, to provide comfort for those who were maybe suffering, or for whom treatment wasn't possible, or who were dying. And the sources teach us that a great deal of time actually was devoted to palliative care, or ambulatory medicine, to be clear. For example, it was written about one monastic health caregiver. He could be seen making his rounds of the monasteries from early morn to the 9th hour, going in door after door to find out if anyone was sick. When he died, he left his wares to one just like himself, and he encouraged him to carry on this service. For there were 5,000 monastics living on the mountain, and there was a need for this visiting. So we learn quite a few things just from these 2 or 3 sentences. We learned that there is a need for this type of ambulatory care. We learn that there are 5,000 monks on one mountain alone, and that's basically a small city. We know that monks who operate as doctors have rounds, so there is a tradition or a pattern in their movement from attending to one individual to another. And we also know that they had equipment. When he died, he left his wares to one just like himself. So in addition to there being equipment, we know that as he's leaving his equipment to someone else, that there is a tradition or a pattern of this particular healthcare practitioner. A few other things worth pointing out about monastic healthcare system is the medical personnel component. We know that in time that monastic medical units, or hospitals, I think as we can call them, have a staff of sorts of physicians, both male and female. And the job of the physicians was to deal with things like diet and hygiene and sometimes surgery, which we'll talk about in a minute, and pharmaceuticals. So to prescribe, if you will, the types of treatment that a patient should receive. As well, there were ministries, and these were also male and female, and the job of the ministries was to serve the sick. So these are the individuals who are tasked with carrying out that which the physician believes might be necessary for the benefit of the patient. But there are other groups of individuals as well. There are elders, also known as stewards, who were responsible for making sure that the patients had clean clothing, that there were medical instruments available, and that they were clean. Sometimes they worked with the diet and the food for the patients, or dealt with basic things of administration and the general regulation and maintenance of a medical facility. As well, there are lay persons, people who are not monks, who would assist in some of the larger hospitals. And of course, there's always self-care. Even a patient can engage in self-care, and so in that way is a type of medical personnel. In terms of methods of treatment, prognosis was the order of the day. And this, of course, involves discerning the type of illness, the type of cause of the illness, and then whether or not somebody was actually ill or not ill, or if they were just trying to get out of work. And so we find in the Rule of the Master, which is an early monastic rule, the master writes, "Brothers who say they are ill and do not rise for the work of God and stay lying down should not be called to task, but for their meal let them receive only liquids and eggs and water, which the sick can hardly get down, so that if they are pretending, hunger at least will force them to get up." I love this passage. I love it because for a variety of reasons. First of all, I love the idea of, even in the 4th or 5th century, you have individuals living in monasteries who don't want to get up and go to work, just like most of us, even to this day, don't want to get up and go to work. And so, like a child in 1st grade who just doesn't want to get out of bed, we have adult monastics who say they are ill and don't rise for the work of God. And so the author of this rule has worked out, okay, all right, don't call them to task, but let's really see if in fact they are ill. Because if they're ill, they're not really going to want to eat just the eggs and drink the water. They're going to want more than that. And if they are pretending, you know what? Hunger is going to get them out of bed pretty quick. So discerning, right, whether someone is ill or not ill is a method of treatment. But if one is ill, there are types of therapeutic treatments that were certainly employed in monastic settings. And this could be from simple prayer to water or oil or laying on of hands or even just massage or other forms of ascetic behavior. Diet could be employed as a method of treatment for comfort and for strength. We all know that there are certain foods after which we eat them, we feel better physically. And then there are also certain types of foods that we know that after we eat them, we feel better emotionally. And so this isn't something that is a 21st century reality. Hygiene, of course, is a method of treatment, making sure that people are clean. And then also materia medica, pharmaceuticals, different types of herbs and drugs that could be employed for the health of an individual. And then, of course, surgery. Yes, surgery, by the time we have monastic communities in Christianity, surgeries have been taking place for hundreds of years. Some of the earliest types of surgeries were as a result of war, although, of course, surgery that takes place either on a battlefield or without the benefit of a clean setting isn't usually as effective as one within a controlled environment. But just to give you an example of the types of surgeries that did happen in this environment, I would like to direct you to the story of Abba Aaron from John of Ephesus's Lives of the Eastern Saints. And this is a pretty graphic account, so just full disclosure. Once Abba Aaron fell under a serious disease of gangrene in his loins, and he bore this affliction with great discretion until his penis was eaten up and mutilated and had vanished down to its root, and his disease began to enter his inner organs. But seeing that he was afflicted by a harsh malady and was cruelly rent in private, we besought him to tell what his illness was. He, for his part, until his wound had worsened severely, held fast, constant in prayer, and filling his mouth with praise and thanksgiving to God. Finally, when he could no longer pass water, he was forced, and so persuaded to reveal and make known his disease. Then the whole of his penis was found to be eaten away and consumed, so that the physicians contrived to make a tube of lead and placed it for the passing of his water, while also applying bandages and drugs to him, and so the ulcer was healed. Furthermore, Aaron lived 18 years after the crisis of this test, praising God and having that lead tube in place for the necessity of passing water. Now, this is a nice reminder that even in these early centuries of the first millennium after the Common Era, that incredible surgical procedures could happen, and in fact did happen, and that they preserved people's lives 18 years after the crisis of this test. So to conclude here, the main innovations in monastic healthcare were twofold. First, you have the infirmary, a dedicated inpatient facility, a proto-hospital, if you will, in which sick monastics were treated and fed and housed. As well, monastic healthcare was innovative in the creation of a skilled nursing corps of individuals equal in status who worked together to care for the ill among them, including the patients themselves. The other point I would like to make is that monastic healthcare and the medical networks that were created because of it were consistent in theology with the argument made in the Gospels that the Christian is to care for the marginalized individuals among them. And that includes the poor, the stranger, the orphan, the elderly, the leprous, and the ill. And in this way, monastic healthcare was consistent because it was guaranteed and it was free of charge. The ill were cared for by doctors, They were offered material, medical, and emotional comfort in their time of need. In this way, it contributed to the destigmatization of illness and otherness in society and the preservation and cultivation of medical knowledge.